Welcome back to another episode of Real Results with Coach Joe. I'm your host, Coach Joe Villegas. This is the program where we help you to improve your health, increase your wealth, and live a more fulfilling life. And I had to bring him back, Dr. Leor Giladi. Thank you for coming on, brother. It's always a pleasure.
Thanks for having me.
Oh, please. We're going to have some fun today.
Yes, we are.
So I know you've been on previously. We've heard about your meteoric rise into the field of physical therapy. But I know you've got a pretty unique message for people today when it comes to health care, and specifically how it relates to how they identify themselves, which is a theme on this show. If for those of you watching at home, if you haven't picked up on it yet, is your identity is going to dictate really all the decisions that you make. So let's dive into the health side of things and sort of what you're seeing when it comes to folks in terms of their diagnoses, or I know you have another term for it, here we'll get to in a second, and how that affects their identity and what they can do to combat that.
Yep. So people get a lot of diagnoses when it comes from like they have some pain or they have some kind of a limitation or an issue, and they'll typically go see their orthopedist, which is like the common first step. And then orthopedists want to be helpful. People are looking for answers, so they give them a name for things. And it's supposed to help people. Like labels are supposed to help people feel more calm and like they understand what they're dealing with.
Certainty.
Exactly.
Yeah.
But the problem is a lot of the labels that they get aren't really helpful. So I kind of refer to them as like orthopedic Diag-nonsense.
Diag-nonsense.
Yes.
Oh, I love that.
So it's a term I picked up from, there's an Instagram account from a guy named Todd Barrett's. His account is literally Your Diag-nonsense.
Okay.
And his stuff's fantastic. Highly encourage people to go look at it.
Check it out.
But I actually thought it was a really like helpful term for what it is that people deal with. So like let's say you go to your orthopedist with, let's say some ankle pain, and they go, oh, so you have an Achilles tendonitis. You're like, cool, I have a name for it.
Yeah, now what?
Now what?
Right.
Right? Because that title, that diagnosis, as you would call it, is more of a description than a diagnosis. It's simply telling you the state your tendon is currently in, but it doesn't tell you why it's in that state or what to do about it.
Right.
So it'd kind of be like if, let's say you're having sleep disturbances and you go and you get a label, you're like, you're an insomniac. And you're like, great, how do I get more sleep?
Right.
Right?
How
Like,
do I do?
what do I do about this?
Right.
And a lot of times I found that people don't leave with more information. They end up with a title, and then they're left to do some research on their own.
Right.
And everyone knows that Dr. Google is not the best place to spend your time.
It can be very scary.
It can be very scary and confusing, because there's a thing when it comes to like the more information you get, typically the less you know what to do with it.
Yeah, the more confused you can become.
100%.
Yeah.
So that's kind of what I want to get into today a little bit, is like understanding what those things mean.
Right.
And where they come from.
Yeah, and I think like right away off the bat, you brought up a good point, is when you get a diagnosis, all it really is, it's a label. It's a way for the doctor to pinpoint, okay, this is in the vicinity of what I know is going on. It can help them make future decisions. It gives that patient, hopefully, but not all the time, some certainty of like, okay, at least we figured something out, right? We're not wandering around in the dark trying to like make sense of what's happening, and they can make decisions from there as well. But what's really a slippery slope is then beginning to identify with that thing. Like we were talking about before we got on the show today is, like previous guests we talked about saying, oh, I am unhealthy or I am fat, and identifying as that, you're going to become that over time or continue to be that over time, versus saying, I am healthy, I just need to make some better choices.
100%.
And identifying as a healthy person. So what are some things off the bat, Dr. Leor, that folks can do, like when they receive a diagnosis, or Diag-nonsense, as you say, I love that, and they get that pit in their stomach, like, oh no, now I am this thing, or now I have this thing. What can they do to kind of begin to make sense of it and maybe draw themselves out of that identity?
Honestly, the first thing I would do, which I don't know why more people don't do it, ask the doctor for more clarity.
Okay.
Like, people get these things and like, oh, okay, great, and then just move on.
Right.
I don't think they ask enough questions. I don't know if it's either they think that was the answer and then like later they realize they learned nothing, or if it's like this belief that you shouldn't question the doctor because some like hierarchy, power authority. Yeah.
I think it might be that. Truthfully, I know growing up, like if the teacher tells you, if this, whoever the authority figure is in that position, it's like, well, you just kind of trust them. Like they went to school for a million years and they must know what they're talking about.
Right.
Until I wised up years ago, and I know when I came to you for my back pain, you're probably like, this dude doesn't stop asking questions, but you have to. And I think, giving folks that power to feel empowered of, hey, I go in, this is not a final diagnosis. I can start to ask questions. Hey, I have ankle, Achilles tendonitis. Okay, well, what does that mean?
Yep.
What does that mean for me? What does that mean for my life and my activity or so forth? So that's a great first step. So what's kind of next on the to-do list?
Yeah, so right before I get into that, thinking about that whole like why people get labels, they get labels for comfort.
Yes.
In my experience, I found that labels don't provide comfort, clarity does.
Yes, I love
So
that.
don't be afraid to ask the questions, because getting the answers as to what's going on and where it's coming from and how you handle it, all that data, that's where the comfort comes from, because you need something actionable.
Yes.
So the next step would be, so typically people get these the Diag-nonsense, and then with a very unhelpful script that says go see a PT and let them figure it out. So that's usually the next step.
Now it's your problem.
Yeah, pretty much. Find a qualified therapist. The thing is that you should find someone when you go to meet whoever you're working with. If the physician didn't give you answers that you like, ask the PT or ask both.
Yeah.
And make sure that you're qualifying the person you're working with, because a lot of times what people do, you go to see a provider and they will treat the result of the problem. They will treat the end stage, like the tendonitis itself, which is a very simple thing to treat. Add some load to the tendon, like through weight, slow negatives, get it to desensitize and strengthen, and that's fine. But if there is something causing it, if you don't address that, it's just going to keep coming back. So it's kind of like, let's say your alignment's off in your car, the front right tire keeps wearing out, and you go to the mechanic, they're like, oh, your tire's worn out, we just got to replace it. And they do that like 9 times. It would be weird if they never was like, oh, let's change your alignment up.
Yeah, let's fix that.
Well, I don't know why in our field it's the same thing. People just keep coming back like, oh, you have a chronic plantar fasciitis. It's just going to be a thing for you forever. It doesn't have to be.
No.
It's as long as you can figure out where it's coming from.
Right. A lot of people don't know that. Like, it doesn't have to be this like the rest of your life. You're just stuck with this thing. It is what it is. We can get to the root cause and treat that. Remember when I came in for my back thing with you, it like wasn't really a back thing at all. It was we worked on my hip a little bit. We did some stuff with like I know like single leg, like lunging and single leg movements to kind of realign me and all that stuff. And some of the movements I was like, is this really going to do anything? And like within the week, I was like, oh my gosh, I feel like my back can breathe again. You know, it's actually opened up and it doesn't hurt when I bend over to pick up a coat hanger off the floor. It actually feels 100%. Good. Yeah.
So basically what we did in that case was we created a bit more space in that right side and the right hip and everything else, so that your back didn't have to take on the brunt of your movement, because you're a big dude who does big training. So if you can't access the hip, something else has to get the job done. Otherwise, you can't stay up and lift the things you want to lift. So we just create space, offloads the back, puts it into the muscles of the hip, and then your back just starts feeling better.
And what's funny about that is, like, had I not seen a qualified professional who could tell me like, hey, here's what's really going on, here's the root cause, I would have been stuck in my head with, hey, I'm just someone who has back pain, or I lift weights, so I just have back pain, that's what it is. And it's funny, like in the strongman community, it's like an accepted thing. Like if you don't have some chronic pain, like you probably didn't train hard enough. If you didn't tear a bicep, like you didn't really do the sport, like all that kind of nonsense, more nonsense. When in reality, it's like, no, you can still lift heavy, you can do the things you love to do in a healthy way. And you can feel really good and get the benefits if you just know what to do. And now, for those watching, you might not know what to do. I didn't know what to do, but I saw a professional. And I think what's another point I want to make sure we touch on too, like you said, is you're kind of getting a couple of opinions, right? So when you see somebody and they say, you have Achilles tendonitis, I guess that's the example we're rolling with today, and you see someone else, a PT, they might say, well, yes, you have that now in this snapshot of your ankle or that tendon, but here's what's really going on. You're doing these activities which are causing that thing. I heard this thing one time where, from a story, a book I was reading, the guy was saying, he had a problem with his brain, and he went to this one particular surgeon, and the surgeon wanted to cut his head open and start operating. And the next guy he saw for another opinion wanted to medicate him, and the next guy, and finally saw a doctor, said, look, surgeon's gonna want to cut, a baker wants to bake. Like they all have their thing and their specialty. That's what they're going to default to. But by getting more knowledge and having that clarity, that's where the power is.
100%. Yep. And you're saying something that I really wanted to like kind of jump into with the different people having their focus. Everyone's going to lean towards their personal bias and the things that they are able to do to help. What's important is making sure you find people who can determine which type of thing you need and direct you to the right individual. So like not everyone who comes to see me is for me to work on. Right? Sometimes people come in and I'm like, this doesn't seem right. And I'll send them somewhere else. But for the people who the biomechanics is the problem, right? And biomechanics and pain are not always connected, and I want to make that like really clear for everyone. The correlation between biomechanics and pain is like, but for the people who have tried other things or have checked other boxes and end up in my office, it usually is a core piece of their problem. All right, and getting back to like what these, like all these diagnoses, like anytime you hear like an itis at the end of something, it means inflammation. All right. Now, people think inflammation is a bad thing because they talk about it as this negative, but inflammation is actually the first step of the healing process, and it's a really important thing to have. The problem is when you have inflammation chronically, because what that means is your body is consistently in a healing state, which means you're pissing something off.
Consistently.
Consistently.
Yeah, right.
So the analogy, like how does a tendonitis or a bursitis or any of those like itises develop, or even like impingements, you get like a shoulder or hip impingement. This is like impingements happen all of the time. Example I usually give people is like, if I turn my thumb down, I try to raise my arm up, that is the highest my arm can go, just based on the anatomy of my shoulder. I am impinging my left shoulder. It doesn't hurt though. Impingement becomes a problem when you become intolerant to it. So think of it like if I push my thumb into my forearm, it feels fine. If I did that 10,000 times, it might start to hurt a bit. And that's usually where the problems come from, is like how we're moving.
The persistent kind of...
It's a little nudges. And I analogize it with a budget. This is one of my big things. I try to help it out. Everyone knows a good budget.
We love analogies.
Let's do it. So when you have a budget, you have two things. You have money coming in, what you earn, and money going out, what you spend. When it comes to exercise and activity, spending money is stress to the tissues themselves, right? So that can come through the form of just like general activity, or like in your case, because you didn't have the access to the hip motion you needed and your back was taking on the brunt, you were probably through the day doing all your basic activities, adding a little additional stress to your spine. That way when you went to the gym and picked up some heavy things, it was already fatigued, it was already kind of upset, right? You'd spent a lot of money already, so when you had to go make that big purchase,
I'm in the red.
You're in the red, right? You're in debt, right? And that's when we start to, when you spend a lot of time in debt, it starts to hurt. Okay?
No doubt.
No doubt. So we gotta increase your intake, right? Or decrease your spending. And in the body, that comes through managing your activities and doing less, which sucks, so don't do that. Or figure out why you're stressing that thing out so much and change it.
So all about that balance.
It's all about the balance.
Incredible. So I know, Leor, we're coming up to a really good spot. So we'll pause here. When we come back, I want to kind of keep getting into more of the Diag-nonsense, helping people get out of that sort of debilitating identity that they might have when it comes with that. So we will get back to that after this word from our sponsors.
Cooper, the host of Cooper Talk Local, and I'm only as hip as my guests. And every week I'll be bringing in locally established musicians, comedians. My guest is one funny mother, Dina Blizzard, to talk about the entertainment world.
We quickly had a hit single and we toured the world and made records as bands do.
And life in general.
I always felt the music and I always would stomp my foot. I would always throw myself around, and that was just natural.
So don't forget, check me out on RBN television.
Wait, I have you surrounded. You just gonna stand there? Or are you gonna take your lawn back?
We're gonna take it back.
We're gonna take it back.
With Scott's Turf Builder Triple Action, it gets 3 jobs done at once. Kills weeds, prevents crabgrass, and keeps your lawn growing strong. Glorious!
No.
Get a bag of Scott's Triple Action today. It's guaranteed.
Feed it, lawn. Feed it.
Hi, I'm Angela Pipersberg, and I have a new show here in RVN Television called The Angela Pipersberg Show. And I want you to join me every week as I sit with guests and we discuss their life journeys, share wisdom, and tips that will inspire you to live your best life. Don't miss The Angela Pipersberg Show every week here on RVN Television, where we're celebrating life and we're inspiring you to greatness.
Welcome back to Real Results. Again, I'm here with Dr. Leor. Leor, we were just talking about this concept, I smile whenever I say it, of diag-nonsense. So you get stuck with a diagnosis, and that's really, like you said, it's not who you are as a person, even though a lot of times we identify with it, because like, I have this condition, I have this problem. What it really is a snapshot of where you are today. So let's kind of get into like, okay, I got a diag-nonsense, now what do I do? Let's take that next step. So let's walk us through that.
100%. So, I mean, the first thing is to realize that like the diagnosis or diag-nonsense, as we've been calling it, it's not you. It is just the state your body is currently in. Because I notice a lot that when people start to identify with their diagnosis, it changes the options they have in general. And I can give you some examples of that as we move forward. But starting to understand that like this is just the state your body's in, and it's a changeable thing,
Right.
and you're not built this way or anything else,
Right.
starts to lead to action steps,
Yes.
right? So it's like, let's say someone tells you that you have something you're born with, like your legs are different lengths and you were born with it. Now,
Right.
a lot of people are told they have different leg lengths. It's not always the case.
Right.
Any kind of shift in your hips can change
Can
leg
result
length.
in that,
The
right.
only way to identify it is by an X-ray.
Yeah.
So if someone tells you your legs are different lengths and you haven't had an X-ray, it's not necessarily true.
Write that one down.
Yeah,
people.
write that down.
Don't
I
forget
had to put that out in the world.
Just in case.
But like, let's say you have that leg length discrepancy or whatever else, and you're like, oh, I shouldn't do bilateral or double leg exercises anymore.
Right.
And then you like never squat again, and you never deadlift, and you
Right.
only do step ups or something.
right,
It
right.
completely eliminates a list of options for you to like train your body, and it might not necessarily be accurate.
Right.
So just that belief that it's not you, it's the state you're in, allows you to start acting towards finding solutions and changing it.
It's much more empowering too, right? When you're like, all right, I'm not stuck to what this is solely by itself. There was a book, I can't remember the name of it, but by Norman Cousins, where he was diagnosed with, I think it was like a fatal illness. And what he did was he was bedridden in the hospital, and rather than sit there and mope about it,
Yep.
what he did was he brought in all, I mean, this is an older book, he brought in all these like old Marx Brothers films and just like, and he would just sit there and laugh, like belly laugh and laugh for, I mean, days. And he ended up reversing his condition.
Isn't that fun?
Because he like laughed himself out of it. It was like the power of laughter because he wasn't sitting there being all bogged down and oh, now I have this diagnosis, now I'm this, I'm that. It's no, I'm laughing my butt off,
Yep.
I'm enjoying life and having a good time. Now, is that going to be the remedy to everyone's
Right.
illness? No, but it just goes to show the power of the mind, and when you have that empowering mindset,
Yep.
how it can really help to make that shift. So now, okay, so we got our Diag-nonsense. Someone says, okay, I'm not that thing.
Yep.
I understand. Dr. Leor told me it's just a snapshot of where I am today, and now I need to take maybe some more empowering action. They might not be getting that from their doctor directly. So what do you sort of recommend for someone who goes, okay, I hear what you're saying, I want to do that, it
Yep.
sounds good, like what do I do now?
Right.
Yeah.
So, I mean, if you go to an orthopedist, if there's nothing's broken
Yeah.
or torn and there's nothing for them to fix,
Yeah.
they're not your person.
Oh, right.
Right? Because that's not their scope. That's not what
Yeah.
they do. That was why they would send you to PT.
Yeah.
So finding a qualified PT would be the next thing. Now, if you're going to see somebody and you get better, awesome.
Yeah.
I'd love that for you. But if you keep finding that the same issue returns multiple times, like you treat the same knee pain like every like 6 to 9 months,
Yep,
and
yep.
every time it goes away, but it keeps coming back,
Right.
then you haven't addressed the root cause.
Yes.
And you need to like look for it either with them, work with them to like find the root, or find someone who does that. Other thing is if you're working on the same thing for a long, long time and it's not getting better, if you have an overuse condition, like all the itises and impingements, they're all overuse conditions. If you have an overuse condition, which is relatively straightforward, like with the budget, and it's not getting better, you got to change the approach. It's not you. You're still not broken.
Right.
It just means what you were doing wasn't working.
Right. I think that's a great distinction. It's not you, it's the actions you were taking. It's not you, the person, it's an event or a series of events,
Yep.
which, I mean, most likely you have control over, right? And you can say, okay, maybe for sake of example, it was, squatting that caused
Yep.
my knees to feel achy or whatever. Maybe your technique wasn't correct. You can still squat. You just see a professional like you. I know you fixed my squat in like 2 sessions, and now I've been pain-free for months. And it's understanding like, okay, it's that event, it's that thing, it's that movement.
Yep.
Maybe I need to tweak it a little bit. Maybe it's the technique. Maybe it's the weight I'm using, the implement I do it with.
Yep.
If you're lifting with a certain barbell or dumbbell, is understand like you have way more options available to you than meet the eye. So to speak,
100%.
right? Would you say?
And like, I do this a lot with people where I teach them how to use pain as an ally
Yeah,
in their
okay.
process, because let's say this version of the squat doesn't work for you. What if I give a heel elevation? What if I widen your stance? What if I set you to a box above knee height?
Yeah.
What if I put a weight in front of you in a goblet squat, or maybe one side, maybe hold a weight in one rack, because that's what your body needs to access the space that you have to be in for a squat. Right? Like there's variations. So I'm all about opportunities, not obstacles.
Right,
So
I like that.
people run into a wall. Let's see what we can do.
Right.
Right? Because there's usually something between not doing it all and doing it the way you want to or used to.
Right. There are options available. And what I like about it, what's funny is, so after Dr. Leor helped me with my back pain, it opened me up to kind of getting back to my roots. I started kind of doing some more CrossFit again. I started doing a lot more walking just to help open things up and whatever. And it was funny because a lot of those practices I continue to this day. We worked together, 9 months ago, something like that, probably since we had the baby. So it's cool to kind of see that stick in something I never expected I would like work into my daily schedule. But now it's a part of that, and I feel even more empowered. Because now, rather than saying, oh, I am a strong man, I can only train like this because that's my identity.
Yep.
Now it's, I've got this whole breadth and depth of things I can do, and maybe if I'm busy one day, I just pick this thing or I do that exercise, and I can continue to keep movement in my life without being tied to my problem or my identity or whatever. It's all available to me.
100%. And honestly, sticking with the identity thing, jumping into a quick personal
Please,
thing, I had a nice long bout of lower back pain after, so I was a powerlifter, people who don't know. I had a big shoulder injury, had a surgery, so there was like a year and a half I didn't like lift very much.
Wow.
Right? Then my identity at the time was, I'm some big lifter, I'm a coach, I do these things, I gotta be the badass and lift a certain way. And it led to me making really poor decisions in the gym and stuck me in like a back pain cycle for almost 3 years.
Wow.
Right? Like I would feel better, I would take some time off, I'd feel better. I would go make dumb choices in the gym. About 3 months in, my back would start to hurt, I'd take a rest, I'd feel better, and I did this for like 3 years.
Right.
The only thing that changed was I had to change how I defined myself. So my identity as an athlete was due to my performance in the past. When I changed it to my identity as an athlete being based on my behaviors, the things I had control over, I started getting better. I started making smarter choices. So instead of I am a good athlete when I can squat, deadlift, bench these numbers, when I can run this fast or do these things that are outcome based, I changed that to I am a good athlete when I prioritize my training 4 days a week. I run 1 day a week. I wasn't doing that.
Yeah, running stinks.
No, it's not. But these are the actions. As long as I stick to my actions, I prioritize getting a minimum of 7 hours of sleep. I eat to support my training, and I work out. I had 4 hard workouts a week, and if I stick to that, I'm a great athlete.
Yeah, no, I love that. What's funny is, and if folks watching get a chance, is go back and check out the previous episode with Coach Jared, because we talked about this exact topic of when you tie your identity to the title, the label, that thing, like I am a power lifter, as soon as that's gone, you kind of lose yourself. What do I do? And Jared was saying when you tie your identity to a higher purpose of, hey, I'm a healthy individual who makes good decisions and does healthy habits and all that, powerlifting is available to you, but if you don't feel like that's it for you right now, it's fine. You can still be healthy and fulfill this purpose. So I think that is a key distinction people need to make, and it aligns right with that Diag-nonsense of like, no, you're not that diagnosis. You are you with your bigger purpose, mission, whatever that is. This is just what's happening right here today.
100%.
So no, I think that's fantastic. So let's keep going on that a little bit more. So for folks who are, let's say they're saying, okay, Dr. Leor, this all sounds great. I'm making this shift in my identity. I mean, what do you think is next for them in terms of like continuing to empower them on their health journey?
Honestly, when it comes to like, if we're talking about health in general, or are we talking about like when they have pain related to the diagnosis they received?
The latter.
Okay, so if it's coming to that pain part, there's going to be a lot of like trust you have to put into the physiology, honestly, like where we tell you these things, but your experience might tell you something different. Every time I squat, my left knee hurts. Okay. So that starts to create this association, and brains are very associative.
They are.
So like, you will now start to anticipate knee pain every time you go to squat. And usually when you're looking for something, you'll find it.
You'll find it.
Right? So that would be the first thing, is trusting that it is not me, it is something I can change. Here's the things I need to change. And if you don't know what all those are, obviously find a professional who can help you out with that. But it's all about feeling the pain in these situations and remembering that it's not your knee, it's not you. Obviously the knee is having something going on. But like, it's not the squat. You can figure out a way to squat. And maybe, you know what, maybe you have to take a step away from the bilateral squats and work on split squats for a while and change your variation. But avoidance gets you nowhere.
Right. You have to step into it a little bit, obviously within the realm of being safe and healthy and all those things. But to purely avoid it means you're never going to address it. Just like back to your budgeting analogy. If you never look at your bank account, you don't check your credit card statement, at some point it's going to catch up with you, and there's going to be a lot more pain associated than if you just stayed on top of it and addressed it regularly.
Or like, I mean, if you're like 30, 40 years old and you start to avoid like squatting, you're going to have a really sad like 30 years, 40 years.
Yeah, especially in your old age, right? Because the last thing you want to do is become decrepit, right, in any way, shape, or form. So it's you know, if you're watching this today and you're saying, hey, you know, I do have a little bit of pain, like see a professional, get with the next level team, like Dr. Leor, these guys, I mean, they worked wonders on me, and I know the other patients they work with, but someone who's qualified can identify what's really going on, that root cause like we talked about, and then give you those actionable steps. So not only do you hold on to your identity, you feel empowered, and then you're starting to make a difference in your actual physiology of what you can do and achieve, right?
And it sounds extreme. I just like want to drive the point home a little bit. But like, I have had a client who had like a 25-year history of back pain.
Whoa.
And one of the things he was talking about wanting to get back to is being able to like bend over and touch his toes. So I asked him, I was like, when was the last time you bent over?
Right.
20 years.
20
He didn't
years?
bend over and reach for the floor for 20 years because
Whoa.
he believed that his back pain was related to a disc injury.
Right.
And if he bends over, his back's gonna like explode.
What-
this is
what
like,
did
he
he-
held that in his head for decades.
What do you do if you like drop something?
He would literally squat vertically all the way down, get on one knee and reach for it.
Wow.
Yeah, I asked him to pick up his shoe off the ground and I watched the process. It was bonkers.
And he has been good at it.
He was
by
very
that.
good at it. He was extremely skillful.
Holy smokes.
But like upright like a board. Wouldn't let his back bend.
Unreal. So talk me through, if you mind sharing a little bit.
Yeah.
How soon after that did you get him to start bending over?
It took about 2 months before he was confident testing it.
Right.
We had to teach him how to round his back in other positions, starting on his back, on his side, on hands and knees,
Right.
and get the movement. And because when you have a belief,
Yeah.
you can't just talk somebody out of a belief.
No way.
They have to see it.
They have to
in
experience
action.
it themselves,
Bingo.
or break it themselves.
Like he had to do the back bending and then be like, am I alive?
Yeah, right.
Can I feel my toes? Okay, good.
But did you die?
Yeah, but
right. Right.
But and you have to do that, and you start really, really simple. You got to meet them where they're at and start in where they feel safe.
Yes.
And slowly challenge them,
Yeah.
one baby step at a time. If you jump too far, they're going to resist.
Right.
And that sets them up for one of two things: either they're just going to avoid you completely and not come back,
right.
or the possibility of something not
Actually
feeling right,
happening, Yeah.
which will then reinforce their belief. And then there's no change.
Right,
Or no
right.
chance to change, because then that'll be the last piece. Because if you get them believing that something can be different, and then it blows them up, they're not going to believe it anymore.
No, not at all. You're actually making it worse, right? But really the key is that sort of balance of, look, here's where you're at, here's where we can get you to.
Yep.
You need to cross that bridge on your own through your own experience and break that belief
Bingo.
yourself. And I think that right there is probably a great place for us to wrap up for today, because we've covered so much. So for folks who go out, they get a Diag-nonsense, maybe in their gut they don't feel like that's not who they are, it's not what they're about, whatever, is don't hold on to that too tight.
Yep.
It's not who you are. It's an event. It's a snapshot of where you are today. Get with a qualified professional, get empowered, and take those actionable steps. And you've probably got more options available to you than you think.
Bingo.
You don't have to avoid things at all. So hopefully I summarized
You
today.
did a great job.
Oh,
That was
all right,
fantastic.
cool. I wasn't even taking notes. This is perfect. But Dr. Leor, where can folks find you if they say, hey, like this resonates, I want to talk to you, I want to get the answers I need to get, where can they find you?
So we actually have 3 offices, fourth one opening in Marlton, New Jersey later this year. It's Next Level Physical Therapy. Our website is mynextlvl.com, and it's the same thing as our Instagram handle. So we have a location in Hamilton, New Jersey, Southampton, PA, Bridgewater, New Jersey, and Marlton coming in the fall. So reach out to us then. Easy, hop on our website, go on our Instagram, shoot us a DM, whatever you need, and we'll be there to take care of you.
Awesome. Thanks for coming on the show.
Yeah, absolutely. My
Appreciate
pleasure.
it. Awesome. And for those of you watching, we'll catch you on the next episode of Real Results.